Today is Saturday, July 29th. By now, you've probably heard of a prescription medication called Ozempic. The FDA approved Ozempic in 2017 as a treatment for patients with type 2 diabetes. But because the drug can also lead to weight loss, its popularity has surged among both celebrities and the general public. The spike in demand for Ozempic has even led to shortages, and there have been reports of diabetes patients struggling to access it. So first today, I'm talking with Dr. Omer Awan. He's a practicing physician, a professor at the University of Maryland School of Medicine, and the host of a YouTube channel called MedEdPage, where he talks about healthcare topics in a way that's easy to understand. He shares his biggest concerns about Ozempic and other drugs like it, from the potential consequences of using it as a quick fix to the message its popularity might be sending our kids. Then later, a celebrity dietitian gives her take, including why she thinks Ozempic can be a lifeline for many people and how it's being compared to Botox. So we're getting a couple different perspectives here, starting with Dr. Omer Awan and how the drug works in the first place. Welcome to the Newsworthy Special Edition Saturday, when we sit down with a different expert or celebrity every Saturday to talk about something in the news. Don't forget to tune in every Monday through Friday for our regular episodes, where we provide all the day's news in 10 minutes. I'm Erica Mandy. It's now time for today's Special Edition Saturday. Dr. Awan, thank you so much for coming on the Newsworthy.
Thanks so much for having me, Erica.
I first just want to get clear on what Ozempic is, how it works, and what it's actually meant for and approved for.
Yeah, so Ozempic is a drug that's known as a glucagon-like peptide analog. And what that means is that it mimics the naturally occurring hormone glucagon in your body. So that stimulates the pancreas to secrete insulin. And insulin, as we know, is a hormone that reduces blood sugar levels in the body. So it's actually meant for type 2 diabetics, because diabetics have high blood sugar levels, and this drug will reduce those sugar levels and is very effective at doing so. I know personally patients that are type 2 diabetics that use this. They love the drug, and it also decreases their risk to some extent of, cardiovascular disease, stroke, and things that are, that diabetics fear, quite frankly. So I think if used properly for diabetics, it's an absolutely great drug. Now, as a unwanted or as a wanted for many patients side effect, it can actually result in weight loss. And it does that because it decreases the time the stomach takes to empty food, so you feel full for a longer period of time. And it also acts on brain centers that act on cravings and appetite, reducing cravings. So people that take this drug actually lose weight.
Does the weight loss that you mentioned impact those results at all?
It absolutely does. I mean, the weight loss also does contribute to some of these other, natural benefits of the drug. So, when you lose weight, you tend to have a decreased risk of cardiovascular disease. You have a decreased risk of a heart attack, a decreased risk of stroke. So all these things are helping in unison for that patient population that need it really to be successful and to live longer.
So what's going on right now for Ozempic being used to treat obesity or even just weight loss off-label, even for people who don't have diabetes?
I want to first clarify that it's not FDA approved for obesity. Wegovy, which is a similar drug that has the same active ingredient known as semaglutide, is approved for obesity, but Ozempic itself is not approved for obesity. And many people are using this drug for obesity, for, weight loss. And it's been touted by a lot of celebrities out there that are using this, and it's gotten a ton of popularity, a ton of attention. And people are actually losing weight, quite frankly. They're literally dropping pounds. But I fear that it's not being used for the right reason, because this is a drug that really should be used for the long term. People are turning to this drug to drop 5 or 10 pounds before going to a wedding, to get a beach body for the summer. And this is not the reason for using the drug. This is meant to treat, first of all, type 2 diabetes. And even if it was used to treat obesity, like Wegovy is, this needs to be used in the long term. I'm talking years. When we, prescribe medicines for patients that have blood pressure or that have high cholesterol, they use it for years, perhaps for the rest of their life, not for 2 or 3 months or 2 or 3 weeks and then stop. That can have devastating consequences for patients.
Yeah, let's talk a little bit more about the possible side effects, both, short-term and long-term, when it comes to these types of drugs.
Yeah, so I think Ozempic in general is tolerated very well. I mean, nausea, vomiting, diarrhea, constipation. These are side effects that we see in many drugs, and it's very well tolerated overall. But in a small percentage of patients, it can have more serious side effects. So, for example, it can result in inflammation of your pancreas, problems with your gallbladder, vision issues, problems with your kidney, and even in some instances, it's linked to a specific type of thyroid cancer. So certainly there are some serious side effects that people should be aware about. Of course, if you're pregnant, if you're under the age of 18, if you have type 1 diabetes, you should absolutely stay away from this drug.
So is the onus on physicians who are prescribing this? Because you do need a prescription regardless of the reason that you're using it, and regardless of the FDA not approving it for weight loss. The drug's website even says Ozempic is not for weight loss, but doctors are still prescribing it. So what does the science say, and why are doctors prescribing it to so many people?
Physicians, first of all, are entitled to prescribe drugs for off-label uses. There's no question about that. If a physician feels that this drug is going to help their patient, by all means, they have the clinical judgment to do that and to absolutely do so. So, that there's no problem with that. But I think physicians have to understand that if they are to prescribe this drug, it should be for the long term, and it should be done appropriately and effectively. And patients should also understand that, if they want to use this drug, they shouldn't just use it for the short term, because what ends up happening is that the majority of patients that use it for 2 or 3 weeks, they gain this weight back. Obesity is a chronic medical condition. It's just like high blood pressure or heart disease, right? It requires not just a drug, but lifestyle modification, right? People should be exercising more. People should be watching the carbohydrates, the fat content that they're doing. Yes, they should take drugs if it's prescribed by your physician, but it requires really a multifaceted approach. And I think that's what's being lost in this whole Ozempic craze.
Do you have any predictions for how you see Ozempic's use changing or evolving? What can we expect to come next when it comes to this drug?
I obviously don't work for the FDA, and I don't, endorse them in any way, shape, or form. I'm just a practicing physician. But what I will say is that I do think that the FDA will get pressure to approve this for obesity. Just like, Wegovy is approved for obesity, that probably will occur given its, popularity. But again, I just caution that this is used appropriately. And I do think that this will perpetuate the things that we've talked about, people, medicating an illness just by using a drug and not looking at all the different facets of a disease, which is already occurring, but it will be amplified. And I think that this, culture, this perpetuation of, being thin and being obsessed with trying to emulate, celebrities and their physique is going to continue to occur, especially amongst, teen girls. And, this is what's leading to this spike in depression, anxiety, and stress in teen girls, which is clear. The CDC, looked at data and found that 57% of teen girls are experiencing feelings of sadness and hopelessness. I mean, this is a problem, right? I mean, more than half of teen girls are experiencing these type of feelings. I mean, this is an issue. And I think this is just going to perpetuate that. And, we really need to act on a public health level.
Still ahead, as Ozempic became all the rage in Hollywood, our next guest came to appreciate its usefulness as a tool to help people lead healthier lives. Kim Shapira is a celebrity dietitian and nutritional therapist in Los Angeles who says she's been helping patients lose weight and keep it off for more than 2 decades. Although she herself cannot prescribe medications, she works with patients who take Ozempic. She shares why she thinks the drug is a net positive for people, why Ozempic has been compared to Botox, and more. But first, a quick break for our sponsors. A friend asked me recently if I really drink AG1 as part of my morning routine, since I've been talking about it here on the show. And I was happy to tell her yes, and that I really do reach for my tea or coffee less often because drinking AG1 makes me feel energized and ready to take on the day. I've also noticed improved digestion. If you haven't heard me talk about this yet, AG1 is a foundational nutrition supplement that can replace your multivitamin and probiotic. And it's just in one simple, drinkable habit. 1 scoop of AG1 mixed with water, that's it. I like to put ice and a splash of lemon juice in it, but see what works for you. And it's one of the easiest habits I've started since it makes me feel good overall, and it makes me feel like I'm doing something good for my body. AG1 uses a science-driven formulation of vitamins, probiotics, and whole food-sourced nutrients. So if you're looking for a simpler, effective investment for your health, try AG1 and get 5 free AG1 travel packs and a free 1-year supply of vitamin D with your first purchase. Go to drinkag1.com/newsworthy. That's drinkag1.com/newsworthy. Check it out. And this episode is also brought to you by BetterHelp. It is sometimes crazy to me how much conflicting information there is out there, from parenting advice to food and health advice. The list goes on. Maybe it's because I research a lot and gather so much data about pretty much everything, but sometimes all that noise can make me question my own decisions. Ever feel that? Well, therapy has helped me to trust myself and prioritize the things that actually matter to me, even in those moments of doubt, so I can move forward with confidence and excitement in all that I do. If you are thinking about starting therapy, BetterHelp is a great option that is entirely online. It is designed to be convenient, flexible, and fit your schedule. All you do is fill out a brief questionnaire to get matched with a licensed therapist, and then you can talk with that therapist however you feel most comfortable, messaging, phone, or video. And you can switch therapists at any time for no additional charge. Let therapy be your map with BetterHelp. Visit betterhelp.com/newsworthy today to get 10% off your first month. That's BetterHelp, H-E-L-P, betterhelp.com/newsworthy. Okay, now to our conversation with celebrity dietitian Kim Shapira. Kim, thank you for joining us here on the Newsworthy.
I'm so happy to be here, Erica. Thank you for having me.
So as an experienced and celebrity dietitian, what are your overall thoughts about Ozempic and drugs like it, and especially their surge in popularity recently, including in Hollywood?
Weight loss is a struggle and has been a struggle forever for many people. And it's not that people can't lose weight, it's that they can't seem to be able to keep the weight off. These weight loss drugs, they're lifelines, as I've said before, for many people who have struggled, who are ashamed and feel persecuted in this space.
When it becomes as popular as it is now, like when does it become too many people want what some people refer to as a quick fix versus this is a lifeline for everybody who is struggling?
Why is it too much? Why can't it be for everybody? We don't know what people's struggles are. And I mean, I hear what you're saying, like the people who have 5 pounds to lose or the people who have 10 pounds to lose. We know people like that, but we don't know what their internal struggle is. We don't know what their private conversations are with their doctors. We don't know if they have any metabolic dysregulation. We don't know what kind of shame and persecution they're feeling. And so I hear your question, and it's like there's that line that we don't want to cross. There have been those people who also have suffered from eating disorders, and they're around, they exist. And I come from a place of understanding that I just want to open people's minds to having a healthier relationship with food, not persecuting them in any way, but getting them to see they can make these changes on their own, and they need to make these changes that are not negotiable for sustainable results. So I hear you, and there's that fine line.
Have you seen people that, we've heard even some celebrities talk about really bad side effects or consequences to it? Have you seen that, or has it mostly been positive? And what's the prevalence of some of these side effects as far as you know?
I think everybody has side effects. So it could be anywhere from mild heartburn to severe heartburn. It could be anywhere from mild nausea to throwing up. It could be anything from a little constipation or, really badly constipated diarrhea. But I think that you also have to recognize the side effects of being overweight are far greater than what these side effects are. Is it worth it? That's a personal choice. I can understand people's fear on, I don't want to feel that way. And you don't have to. You can actually do it all by yourself. We have the ability to regulate our hunger and satiety just by following my rules. So it's, again, up to you how you want to do it. But I'm not shaming anybody who is doing it.
What's your take on using it in the short term versus long term? If you want to lose 20 pounds before a certain event or even a movie for celebrities versus someone who's, okay, I'm in this for the long haul.
Okay, 100% no, hard no. I put my foot down on that. So it's, again, anytime I've ever had a client who said, I want to lose weight to do this movie, or I want to lose weight for this event that's coming up, my focus has always been the day after the event, what happens after. And so, no, 100% it cannot be short term, but it could be part of your plan, and you have to learn how to maintain it on your own. I don't think these drugs are going anywhere. I think they're going to be around for a very long time. So I think that we have to figure out what that looks like. I did an interview for Sky News in the UK a while back, and they refer to it as Botox. So we could occasionally just come in and have a little bit of a Botox fix and then move on. And, now that people have been on it long enough, it's been around for a while, but in the short term, in this last few months that we've seen, 8 or 9 or 10 months of people doing it, what we're finding is that people are able to maintain their weight because they've done the work, hopefully, to keep it off. And if they are gaining 2 or 3 pounds, I think doctors are prescribing a one-time shot every couple of weeks or months to kind of do a little boost to keep you in this normal range. So it is a little bit like Botox.
And I want to play devil's advocate a little bit just to get your take on it, that there are people who feel drugs like this is sending a dangerous message that thin is always better, thin is always healthier, and could even contribute to more eating disorders. What's your take on that?
Well, I'm a registered dietitian, so it's not that I think thin is in. I think that we have this normal weight that kind of tells you if you're at this weight, all your blood tests and your health is balanced. And I think instead of thin is in, we should be focusing on what does my body need to make me feel the best that I can.
Before we go, I would love to hear your take on some top strategies to be the healthiest you can be, even, when you don't use drugs, whether or not you're using drugs. What are some top tips for being your healthiest self?
If you're not hungry, something's going on. It could either mean that you're overeating or your body isn't moving often enough. So focus on hunger. You always want to get hungry, but you don't want to stay hungry. That's number 1. Number 2, always drink 8 cups of water. Try to do it. If you are at 6 one day, don't beat yourself up, but really aim for more because it's how we naturally detox and cleanse our body. So eat when you're hungry, drink your water, and move your body. Always take advantage of moving your body. Every single day, aim for 10,000 steps. Use your arms a little bit more, dance, hopscotch. It doesn't matter how you move your body. Just find ways that you love to do it, and every day make an effort. It's really important for your digestion, your hormones, your sleep quality, and your weight maintenance.
Final thoughts or words of advice, specifically when it comes to our discussion around Ozempic and drugs like it?
I would say let people be, wish them well, and just focus on yourself.
Well, thank you so much to both of our guests today. Kim Shapira's new book is called This Is What You're Really Hungry For, and it's available now. Dr. Omer Awan's YouTube channel is called MedEdPage, and you can check out the links to both in our episode notes. Of course, be sure to hit that follow or subscribe button in your podcast app so you get new episodes of The Newsworthy 6 days a week. Our regular 10-minute news roundups are available every Monday through Friday, and then we bring you these insightful interviews that are our special edition episodes every Saturday. So we'll be back on Monday morning with your next 10-minute news roundup. Until then, have a great weekend.